Therapeutic exercise program is one of the therapies in orthopedic occupational therapy. A conservative treatment method will use various equipment and modalities to improve joint range of motion and muscle strength. One of the tools that is suitable for hand, wrist, and finger training is the iTAC043, which is an import product that is expensive and difficult to buy. For your information, occupational therapy students were trained to use all relevant modalities in rehabilitations during orthopedic laboratory sessions on campus. Due to the high cost of some equipment, not all equipment was available for demonstrations during the lab session. In other situations, there are bundles of scrap splinting materials in the orthopedic laboratory. Therefore, in this study, the thermoplastic scrap was utilized as a clinical solution for teaching clients to exercise the hands and fingers.
Handy MoveMate is designed for rehabilitation of the hand, fingers, and forearm.
A survey was conducted to get feedback about the usage of Handy MoveMate during the orthopedic lab session and to gauge interest in the application of Handy MoveMate to clients with hand injuries. 3 questions were asked regarding the product suitability for training, product features and benefits, and also product improvement. As for result, both OT and OT students strongly agree that the Handy MoveMate is suitable for hand training. Most students and therapists also strongly agree that the product features incorporated fine games in OT treatment and give the best solution for scrap waste. In addition, therapists strongly agree that 7 rollers are complete for training and is a perfect tool for clients with hand injuries. Clients also agree that Handy MoveMate is suitable for hand function training. For improvement, content validation of the product were taken from the feedback response from the users, especially OT students and therapists in facilities. There were 6 main themes emerged from the responses.
Handy MoveMate is designed to allow students opportunity to have tools to practice giving interventions to clients with hand and dexterity issues. Besides that, the tools were made at lower cost compared to tools purchased from imported vendor and easier to get. By using these scrap thermoplastic materials, it will reduce wastage as the materials will be recycled to build new intervention tools as a teaching aid. As for the novelty, the Handy MoveMate is designed for occupational therapy students to use as a teaching tool for therapy during orthopedic laboratory sessions. It is also create opportunity to practice for hand and dexterity interventions before they go to the clinical training. Besides that, this Handy MoveMate has added play or games activity such as the rolling ball into target compared to the rigid hand exercises available.
The Handy MoveMate is designed for occupational therapy students to use as a teaching tool for therapy during orthopedic laboratory sessions. In addition, this new invention can help occupational therapists to use waste and recycle items in rehabilitation. It also creates a fun and engaging environment for learning as preparation before going to industrial training in the final year, semester 5 and 6.
In conclusion, the Handy MoveMate is less expensive and has become a good orthopedic teaching tool for therapy. It is emphasized that this study solved the problem of thermoplastic waste from the orthotics lab. The Handy MoveMate is suggested to be used among healthcare professionals, including OTs in clinic and hospitals.